We're just good afternoon, everyone. I'm going to make a start because we want to be as timely as possible. Welcome to this meeting. I'm Paul Johnston. I'm chair of the Faculty's Climate and Health Committee, and I'm really pleased to welcome you to this event, this really important event, which we have identified a big need here across the faculty in looking at the synergy and connections between air pollution and air quality and climate change, and particularly the actions around co-benefits for health and climate. We'll be looking at the latest evidence, policy, but also to encourage leadership locally, regionally, nationally, and indeed as well. I'm really pleased that we've got Chris Whitty, our Chief Medical Officer, joining us. So I'm going to ask Kevin very quickly if he could introduce Chris, because Chris will need to leave at 20 past on the dot. So Kevin, over to you, and I'll say a few words at the end. Thanks very much.
Thank you very much, Paul, and good afternoon, everyone. I'm so pleased that so many of you have been able to join us for this really important event focused on air pollution. And I'm especially pleased that we have such a fantastic lineup of speakers with our Chief Medical Officer, Chris Whitty, joining us today. Many of you are aware that Chris's last annual report focused on the issue of air quality, really being a sort of clarion call for us, both in public health and across the wider health and care system, to really take this issue seriously, to build upon lessons and emerging best and promising practices from across the country and internationally. So I'm really pleased that Chris is going to be getting us started today as we spend time reflecting on air pollution, air quality, and climate change. So with that, Chris, welcome, and over to you.
Thanks, Kevin. Thanks, Paul, and good to see everybody. I'm really just going to, because I'm starting off, I'm going to make some fairly obvious overarching points to lead into the rich discussion that follows. For any kind of technical details people are interested in following up on, as Kevin said, I did my last report on air pollution, which I've put a sort of picture of here, and the authoritative sort of Bible really of climate change is the IPCC report, and some of the data I'm going to be talking about really essentially comes from that. It's an extremely good read for those who are interested in this area, although a depressing one. Next slide, please. So air pollution and climate change are both very significant threats to health, both current and future. Air pollution effects are already very substantial, but they are in fact improving. So if you look back 30 years, we're in much worse shape with air pollution than we are now. But that doesn't mean that the problem has gone away. It is still very substantial, has big effects, which we'll come on to. Climate change, on the other hand, things are getting steadily worse over a more shallow trajectory. But the problem with climate change, or one of many problems with climate change, is for practical purposes, and certainly over our lifetimes, once change has occurred, it is irreversible. I mean, it would take a very long time for this to reverse. So the area under the curve for the climate change effects on health are very large indeed, because they are stretched out right over very long periods of time. We should, of course, acknowledge that climate change health effects will be even more severe in many parts of Africa, Asia, and Latin America, low resource settings, for a variety of reasons. But nevertheless, they will be substantial in the UK and Europe as well. And running through quite a lot of what I'm going to say is the central role of engineers. Engineers have been central to public health right back from the early days of combating cholera and typhoid, with civil engineering absolutely central to both of these major problems. Next slide, please. So just a quick recap. I mean, health effects of air pollution occur throughout the life course. I think everyone on this call will know that, right from pre-birth all the way through to old age. The effects vary and over that time course, and there are acute effects that happen, like, for example, on a bad air pollution day, people having acute asthma attacks, potentially strokes with PMs, through to more chronic effects, probably, for example, dementia. Next slide, please. In the UK, most of the major forms of air pollution have been improving, though not all. A big exception is actually ammonia, which tends to lead to secondary particulate matter. But that doesn't mean that the problem has gone away by any means. Some things have improved very substantially, like lead, which is really now no longer a problem in air pollution because of changes to petrol formulation, and sulfur dioxide, which used to be a very major part of our mix. But particulate matter and NOxes in particular remain a very significant problem. Of course, air pollution, the big issue is it has to be where people actually are exposed. That's very different, and that's one of the key differences, in fact, to the situation with climate change, which I'll come on to. Next slide, please. So the effects of of climate change on health are extremely varied. They range from the very direct effects. So, for example, heat stress increasing as the number of very hot days increases, but it also includes big impacts on water and agriculture and water supply. These, of course, are the kind of things that will be even more of a problem in parts of the global south. Vector-borne diseases. So put an example here of the change in some of the Aedes vectors of quite a large number of significant diseases like dengue and Zika as a result of climate change, and the same is true in other parts of the world, and natural disasters, including floods, droughts and storms, are all things which are going to be changed and generally made worse by climate change. Next slide, please. The biggest effects of these are obviously in the future, but nevertheless, there are already effects of climate change being seen here, even in the UK, which has a relatively temperate climate. And an example here is heat issues. We had the hottest days on record last year, and in extreme cases heat stroke, but heat stress increases mortality, particularly in very young and very in the oldest people. And you can see very clearly on the mortality the spikes that occurred when we had these very hot days in excess mortality. So there were about just over 2,000 excess deaths over this very short period of time due to heat stress. This will be repeated from here on in, and things will in fact get worse. Next slide, please. So there are some things which are very similar about climate change and air pollution, but also there are some differences. And this is, I think, one of the key things we need to think about when we're running through our consideration of this problem. And I'm just going to illustrate a few of those over the next few slides. First one is around geography. And geography is very important because it's quite different between these two sets of problems. In the on the right here, what we got is the effects of the air pollution in the UK. And as you can see, the biggest effects of that are highly concentrated in the southeast and the major conurbations, unsurprisingly. You really worry about air pollution where people live. On the left, what we see is the effects on the population of climate change. And in this case, I've taken an example of flooding, which can be fluvial, so downpours, river flooding, or storm surges in winter, all of which, for different reasons, are likely to be worse with climate change. And that is much more widespread. So the geography of the impact of this in health is going to vary around the country. The other thing which is important about geography on this is that with air pollution, one of the mitigations you can have is to move polluting industries you can't depollute any further away from human habitation. In the case of stopping CO2 and other greenhouse gas emissions, it doesn't matter where they're produced. So they are geographically completely agnostic. So that's quite a big practical difference. Next slide, please. So in general, the geographical footprint of air pollution in the UK is contracting, give an example here of London, and the geographical footprint of the health effects of climate change is expanding. There are exceptions to both of those statements, but broadly, that is what we are seeing and will continue to see over the next 2 decades, and in the case of climate change, well beyond. Next slide, please. Now, my key point with this through the rest of these slides is to say there are some areas where air pollution and climate change, what we do is essentially, if something's good for one, it's good for the other. There are some areas where it's neutral, and there are a few areas where the two aims are in tension. The first is road vehicles. So road vehicles is a good example where the two run together. Much of the big improvement we've seen, and we have seen improvements in particulate matter and NOxes over the last decades, has been by making engines significantly more efficient, leading to reductions in CO2 emissions as well. And the switch over to electrification, which will deal with tailpipe, they're not other air pollutants, will take a further step along the path. So here's an area where road vehicles is an area where the two aims are very, very similar. There's an exception to that, which was the push towards diesel at the turn of the century, which was good for climate change, but less good for air pollution, in fact, bad for air pollution. Next slide, please. Urban planning and improving active travel are another area which run together. Anything which can move people over to active transport is excellent for public health generally, good for air pollution, and has marginal but importantly useful benefits from climate change. So here's another one where the two are essentially, as the title implies, two sides of the same coin. Next slide, please. Our effects on industry are largely also run together. A lot has been done to reduce pollution from industry, and much of that has also de-intensified the amount of energy use and therefore the impact of CO2 from industry. There is an exception to this, which is that one of the ways we deal with air pollution is also to move industries away from people, which has no effect at all on climate change, clearly. So I think it's important to say that much of industry, the aims are similar, but in some they are essentially neutral. Next slide, please. And then effects on agriculture are also largely run together. Production of fertilizer is an energy intensive business. Anything we can do to reduce intensive ammonia use is a good thing for air pollution and will also have indirect benefits for climate change. So these are ones where, by and large, climate change mitigations and air pollution reductions are similar kinds of activities. It also has a wider impact because by reducing ammonia use in particular and other nitrates, you reduce air pollution, but you also reduce runoff into water. So it has other ecological impacts. Next slide, please. And the NHS is an area, it's a very big employer. It has the second largest vehicle fleet in the country after the Royal Mail. You know, we must, as health people, look seriously at our own area, and reductions in energy use, reductions in carbon emissions, and improvements in air pollution largely run together. There's an exception to that, which is around ventilation, which I'll come back to. So these are all areas where there is a positive interaction between these two agendas. Next slide, please. So for outdoor air pollution, my view is, with a few exceptions, the two aims have similar directions of travel. When it comes to indoor air pollution, there are some important differences. And when it comes to, when we're reducing sources of indoor air pollution, there is often a lot of synergy between aims to reduce climate change emissions, but when it comes to ventilation, which is the second thing, which is a key part of dealing with air pollution indoors as opposed to outdoors, the two are potentially in tension. Next slide, please. So when it comes to domestic space heating, which is a major part of energy use in houses, the two do tend to run together, although there are some exceptions. And I think that the debates we've had over moving from solid fuels over to gas and then to electricity, by and large, are ones where the two agendas are very similar. I think if you'd asked this question 5 years ago, people might have said, well, people using wood potentially is a very good way of doing this, but I think I think people really have moved away from that position, which I don't think was supported by the evidence. Next slide, please. But there are some areas where there are some competitions, and I think what I wanted to do is my final slide, and this is the bit where we need to be cautious and be very clear, is we should be honest about the areas where there's a strong overlap in these genders. Also note the ones where there's essentially neutrality. There isn't really much impact one way or the other from one agenda to the additional one, and ones where there's potential competition. So areas of clear overlap, I think, are reducing air pollution from vehicles, active transport, reducing emissions from industry, actions to reduce air pollution in agriculture, and many activities which make any system, including space heating in the NHS, less carbon intensive. By and large, those are all areas where if you do something useful for air pollution, you'll do something useful for emissions and vice versa. Potential competition is in particular around ventilation versus conserving heat on indoor air pollution. So it's a very clear aim to increase ventilation for public health reasons. It's good for air pollution. It's also actually good for airborne infections, as has been clearly demonstrated over the last 3 years. On the other hand, there's a clear necessity to conserve heat, to maintain heat for vulnerable people in housing, and that in the UK housing stock, in domestic situations at least, generally means reducing ventilation. And we've not really found good engineering solutions yet, even to large public buildings, where we can resolve the tension between trying to maximize ventilation and minimize heat loss. There are also policy choices where people think only of one of these problems and cause problems for the other. And the classic one was the 2001 push towards diesel in light vehicles. It probably would have made less of a difference now, actually, because the diesel vehicles are much less polluting, but it was a considerable problem at the time it occurred. And there are quite a lot of areas which are essentially neutral, of which the example I've given is moving polluting industries away from habitation, which is good for air pollution, but has, for practical purposes, no impact usefully on climate change. So Kevin, those are all introductory comments, really. I think they're all hopefully pretty obvious to most people on this call, but I thought it was worth doing that overview as it's the beginning of this this conversation.
Yeah, thanks very much, Chris. And as you say, it gives a great context to the rest of the seminar. And we're bang on 2:20, Chris, so we can let you go with a big thank you. And there are a few questions which I'm going to ask the panel to pick up later on in the session as well. But I want to, Chris, unless there's any last words, thank you very much for your time, much appreciated. And I'm going to hand over seamlessly now to Kevin. Kevin.
Wonderful. Thanks, Paul. And thank you, Chris, for a great start to the session. Colleagues, I'm going to shift now. I wanted to spend a few minutes reflecting on the faculty's work in this space to share with you the governance and the structure that we currently have that has a resolute focus on climate change and climate justice and how our work on air pollution fits into that. As many of you know, I'm also the Regional Public Health Director for London, and I wanted to briefly reflect on London's own journey in tackling air pollution and some of the lessons that we've acquired along the way when it comes to the framing of this issue as a public health issue and concern, and what we might do to further engage our citizens around the nexus between tackling air pollution and climate change. So I'll be covering those couple of things in the next few minutes or so. Next slide, please. So as many of you on the call are aware, the Faculty of Public Health has prioritized climate change as one of our core priority areas for the board and for members. And we have identified this as an area where we are keen to have a heightened advocacy and policy action, certainly over the next 3 years, building upon the fantastic work of our climate change subcommittee and special interest groups. We have identified this as the single biggest threat facing humanity, and we have been clear that focusing on ambient and household air pollution must be part of the work that we do in this space as well, really fitting in nicely to what Chris has articulated in terms of thinking about climate change and air pollution in a much more holistic way. Chris has identified some of the data that underpins why we're interested in climate change, and certainly, whether it is its impact on malnutrition, infectious diseases, the temperature impacts, including heat stress, or a range of other adverse health outcomes that we're going to be concerned about. Next slide, please. Now, a key part of how we are viewing this is ensuring that as a professional body with nearly 5,000 members here in the United Kingdom and globally, we're clear about our narrative on what as a faculty we're doing to be part of the solution in dealing with the climate emergency, but also what we do to leverage our partnerships and our relationships with other professional bodies, professionals and the public in this space. So health organizations, including Royal Colleges and faculty such as ourselves, have a key role to play in advocacy for climate change and sustainable climate action. And we have to look internally to ensure that we are both reducing our own climate footprint and also inspiring and engaging with our members around this agenda as well. And as you heard from Chris and certainly others have reported that the health and social care sector has a significant role to play in this regard, both in terms of how we engage our workforce, how we think about creating greener environments and more sustainable environments, and reducing our footprint as well. Next slide, please. So for a climate change and sustainability perspective for the faculty, our work is going to be underpinned by a number of core values and core principles, key of which is a focus on justice and equity, recognizing that the impacts of climate change and the impacts of poor air quality are not randomly distributed within our population, but they're particular demographic, social and economic subgroups, which will bear a disproportionate burden of this change. And therefore our efforts must be not only to raise awareness about these issues, but to ensure that we're mobilizing communities and leaders which are able to influence the trajectories for the most vulnerable within our society. And much of this work is being led, as I said earlier, by our special interest group and our climate and health committee, and guided by our climate and health strategy. Next slide, please. So to briefly reflect on the strategy, it goes from 2021 to 2025. So we're almost midway through that strategy. And really it is geared towards having clarity and transparency on what we're doing as a faculty around this agenda. There is a focus on ensuring that the public health workforce is empowered and has the knowledge, skills, and capacity to work on both mitigation and adaptation when it comes to the climate emergency and the impacts on the environment. And we really want to ensure that we provide resources to members who are at the forefront, whether in local authorities, in the NHS, working in national public health agencies, that the workforce have the tools to be able to do that advocacy work and to be clear about what the public health priorities and asks are for organizations and partners to deliver. A key part of what we will be doing over this period is to ensure that we continue to advocate for the climate justice and inequalities agenda, which must be a core consideration for any work that we do as a faculty, but also work that we're expecting and supporting our partners to do in this space, whether locally or globally. And then thirdly, to ensure that we continue on our journey to be a net zero organization in the faculty, so that we are among leaders in medical Royal Colleges, but also leaders within organizations on the how to do this and the way in which we demonstrate consistent leadership and aligned leadership between what we're saying and what we're doing as an organization. So if you haven't seen our strategy, I'd like to commend you to it, because it does provide a very clear direction of travel for the faculty and what we're hoping to achieve. Next slide, please. Now, the work of the faculty on climate and health has been taking place over many years now, and in fact, more than a decade. And this has been consistent leadership in this space, building upon our advocacy, building upon the emerging evidence, and ensuring that we continue to bring our partners along with us. So whether it is our work to declare a climate emergency or work to divest from fossil fuels, many amending our curriculum and ensuring that our voice as an organization is contributing to the global as well as national agenda on climate action. These have been clear pillars of our work as the faculty over the past decade. And these would be areas where we would continue to see that progressing in the years ahead. Our special interest group and the Climate and Health Committee continue to play an important role, and they have done through development of our strategy, ensuring that we have a presence and are contributing to the COP conferences, ensuring that we have a proactive strategy for responding to government consultations with respect to both air quality and climate change, develop a series of resources for our members and partners on sustainable development to support the public health workforce, and hosting events such as these, such as conferences, as well as other educational events, so that we continue to build capacity for our workforce and our partners moving forward. So in the next slide, we show that trajectory over since 2018, looking at some of our more recent accomplishments in this space and the journey that we've been on over the past decade in this area. What is great is that we have a great infrastructure in the faculty that is driving this work. We have a growing body of members and partners who are seeing the work of the faculty and are joining us to become part of that wider network of professional bodies and organizations engaged in this space. And we will use the next 3 years of my presidency, but also of the new board, to continue to ensure that climate and health remains one of the key policy advocacy area and policy action areas of the Faculty of Public Health. Next slide, please. So there are a number of resources which are available for those of you who may be interested in learning more about climate change and sustainability. And I'd encourage you all to visit the faculty's website to access these resources. They include issues, as you can see on the right-hand side of the slide, topics related to sustainable economies, an overview of climate change, really looking at sustainable food systems, the NHS carbon footprint. So wherever you are in the system, we have developed resources which will speak to your needs and to provide a helpful tool for you to understand both what the evidence says are opportunities for intervention, as well as emerging best and promising case studies to demonstrate what is feasible and what has been achieved in this space. So I would commend our online resources to you all as well to get a sense of where our public health agenda can be both refined and advocated for as in partnership with colleagues working in the faculty. Next slide. This then brings me on to my very quick reflection on the journey that we've been on in London on improving our air quality and thinking about some of the lessons of that journey for our work with climate change and responding to the climate crisis and climate justice. Now, as many of you know, air pollution is a major public health challenge in London. The CMO has identified and presented some of the data and some of the journey that we've been on in terms of cleaning up London's air. In the few slides that I'll present, and as I reflect on London, you will see that the changes that we have accomplished in London have taken place over many years. They've involved strong collaborative efforts and partnership. They have been built upon a robust evidence base which continues to evolve related to which interventions are most effective, the implementation of those interventions, and almost real-time evaluation of the impact of those interventions to continue to make the case for further action. So this slide is animated, so I'm going to ask colleagues just to click on the next image. And this first image was presented by the CMO, demonstrating the reductions in air pollution emissions over the past 50 years from 1970 to 2020. And in the next slide, please. Wanted to just highlight some of the key actions taken in London on our journey to improve air quality. Now, many of you are aware that the Mayor has proposed and is planning to expand the area covered by the ULEZ later this year, but bear in mind that the journey to this point has been a long one. London launched its first emissions control scheme, the low emission zone, in 2008, and at that time it was charging people to drive certain heavy goods vehicles into the city centre. This was further strengthened in April 2019 with the ULEZ, which is the world's strictest low emission zone and covers a range of vehicles. And this, in concert with other interventions which have been put in place, have really resulted in a reduction in emissions and a boosting of air quality in the city. But there's a limitation on how those interventions alone can take us in terms of cleaning up London's air. So more schemes are in fact planned and needed. So in November of last year, the Mayor announced plans to expand the ULEZ to cover the whole of Greater London, and this will ensure more Londoners are able to breathe cleaner air. And this is a big deal for us in London as we prepare for this final journey of expanding the ULEZ. And many of you would have seen that this is not without its detractors and colleagues who have, and members of the public who may have concerns about the feasibility and acceptability, the evidence that underpins this. And this has been part of the journey of getting to this place where we have robust evidence, a robust package of interventions, and the evidence that underpins the rationale and the anticipated impact of this expansion. Next slide, please. So if I had to briefly demonstrate some of the emerging impacts of these expansions on nitrous oxide, perhaps it's best known that we've seen this significant reduction in nitrous oxide between 2013 and 2019, and that will continue to be seen as we expand the ULEZ, and as we see both behavior change in London citizens, changing in vehicles, and changing in driving practices across the city, we would expect that this will further be accelerated with the expansion of the ULEZ. Next slide, please. So in terms of key aspects of the journey in London, as I mentioned, progress has been made. It has been the result of a combination of interventions over time that is resulting in the reductions in pollutants in London's air. We still have a significant worse air quality than other parts of the UK, and many parts of the city are again exceeding acceptable limits, certainly for the UK and in terms of European standards. We know what is contributing to most of the poor air quality in London, and doing what we can to especially ensure that the contribution by road transportation is managed effectively, whether through the ULEZ or other schemes, will be a key part of our journey to continue to improve London's air. Key to underpin in this journey is the multifaceted approach to cleaning London's air. It hasn't been a single intervention, although we've had some interventions which are perhaps more powerful than others. And that combination intervention approach has been part of our journey in the city. So whether it is promoting active travel, looking at ways in which we improve the public transport infrastructure. So we're shifting people from driving cars into taking and using public transportation, upgrading cycle lanes, and ensuring that speed limits within streets are now limited to 20 miles per hour. There are a range of tools and interventions that have been put in place. So that combination intervention approach has been critical in our journey to reduce air quality, improve air quality in the city. And in the next slide, reflect on some of the other considerations that we've had to ensure are part and parcel of the journey. So how do we, as we are implementing these combination interventions to reduce air pollution, ensure that the equity considerations are at the forefront of the decisions and the policies, and understanding the impacts as we move forward? So not only are we looking at reducing air pollution in the areas where we have some of our most socially and economically disadvantaged communities, but understanding what does the transportation package, the interventions that we're putting in place to help people to switch from more polluting to less polluting modes of transportation. How does that play out as you think about the inequalities across the city? As I mentioned, ensuring that we had a robust infrastructure for both evaluating and understanding the patterns and distribution of air pollution in the city, but also ensuring that those data are available to Londoners so that Londoners can make better choices related to air quality and the risk of being exposed to air pollution. That has also been a part of the journey as well. Finally, partnerships have been key to success, and there are a range of organizations that we have worked with, and the Mayor of London, the GLA, and local partners have been working with, both in terms of understanding the data, research institutions, and the evidence related to the interventions that need to be in place, collaborating on evaluating the impact of those interventions, looking at innovations in technology so that we can employ and deploy more air quality sensors across the city, providing that real-time hyperlocal information to Londoners so that, again, choices can be made, but we can use those data to both evaluate where to target interventions to have the greatest impact. So the use of data, the partnerships with academic colleagues have been a key part of the work that we've been doing. So in summary, I think the story so far has been one of using and identifying combination intervention approaches, working with and understanding the impact of these interventions on communities, mitigating the unintended consequences of those interventions as far as possible when it comes to helping people to shift their modes of transportation, and as we prepare for the expansion of ULEZ, ensuring that those who need to make investments in terms of shifting modes of transportation, upgrading vehicles, are supported in doing so, while continuing to take Londoners forward in terms of why this is important for all of us. Now, in the final two slides, I just wanted to reinforce, I think, some of the core narratives for change that we continue to work on in London as we come to tell the story about reducing air pollution, and what of these narratives might be relevant in our journey in tackling climate change. I think there are 7 key areas which are really important for us, which we as partners are working in London when it comes to the public narrative around the importance of this work. So the first is ensuring that we continue to root our efforts and our interventions on the evidence, and to be clear about that evidence to members of the public and our partners. Why is air pollution a challenge? What is the benefit that would accrue to Londoners individually and collectively as a result of intervention, the cost of that intervention, and of course, how that helps to reduce inequalities. So ensuring that we're basing our policies on the best evidence. Second is to ensure that we continue to create that burning platform for change, that it is not acceptable for us as Londoners and as citizens to be living in and operating within an environment which has such poor air quality and the knock-on impacts on chronic diseases, on mortality and morbidity within the city, and creating that burning platform for change to create that sense of urgency, in part because for many Londoners, not being able to see or feel the air pollution necessarily means that that sense of urgency for change and action may not be there. So really identifying both the narrative, the data, the examples and the case studies, which can bring this to life to everyday Londoners, is going to be key. And there will be implications for that for climate change as well. The third is making sure that change in air pollution is everybody's business. It can't just be seen as something that people living in central London should be concerned about, as opposed to those living in outer London. It can't be something that Londoners feel that this is only something for people who are socially and economically disadvantaged, who live in the poor parts of the city, versus those of us living in greener, leafier parts of the city shouldn't have to worry about that. So really ensuring that we identify the ways in which we tell the story, that actually tackling this together is everybody's business. It's important across the life course, and it is important for all of us to be engaged on this, and we all stand to benefit in London as a result of this. Again, might there be opportunities for that public narrative for how we frame air pollution and climate change? And in the next slide, the next 4 elements of this narrative, 3 elements, are around that resolute focus on inequalities, which I mentioned, and ensuring that we continue continue to demonstrate that actually there is a justice element for this in London that underpins why this work is important and why we need to be doing this collectively, and to ensure that as we implement interventions, not only are we making the case for how all Londoners benefit, but to demonstrate ways in which we're narrowing inequalities in the city and the economic and social benefits of that narrowing of those inequalities. We can do that with air pollution, and we can use that as an opportunity for thinking about how we frame or work on climate change. I've already mentioned ensuring that people view these interventions not as single separated interventions, but we're able to tell the entire story for what we're doing on reducing air pollution, and ensuring that that comprehensive, holistic approach is understood by Londoners. So the connections between more cycle lanes, a greener city, promoting walking and cycling, as well as expansion of the ULEZ and using of low traffic networks, we're able to pull that together for Londoners. So we see this comprehensive approach, but we also understand where Londoners may push back or have difficulties with elements of this, but to ensure that we're meeting concerns head on and addressing them honestly as we move forward. And then finally, the alignment of London's leaders and communities, really, really important. This work cannot be done without taking local communities along with us, listening to concerns and meeting them head on, both with evidence, but also seeing what financial support, what social support, what other types of support are needed to help to move populations in the right direction and communities in the right direction, recognizing that different communities across the city will be at different places, different readiness for change, and meeting communities where they're at, working with local politicians and councillors, community organizations, and networks locally will be a key part of that journey too. So colleagues, we've come to the end of my time. I think this is my final slide, just to say that there's a lot that we have learned in our journey to improve air quality in London. The journey is not yet finished. And as we prepare to expand the ULEZ later this year, we will undoubtedly see both an increased need to engage everyone in the city for this next phase of our journey to improve London's air quality. But we also have to think about, well, what next as we progress in this journey, and what might we use in terms of emerging lessons that will be important for us as we work to tackle climate change. So with that, Paul, thank you so much. I hope that overview of what we're doing in the faculty and maybe a worked example of our journey in London is helpful for the conversations today. Thanks.
Yeah, thank you very much, Kevin, and excellent timing. Really, really excellent presentation. Very succinct. I think, Kevin, are you okay for a couple of questions that have come up, if I may? And Kevin, are you okay with that?
Yes, definitely.
Yep. So the very last one in the list there, I think is quite good. Is people are probably considering, what is it that other areas outside London and across the UK could draw from this? I think some of it you mentioned in your last slide, but you've got any particular messages for people on the call today about their local area, what you have specifically learned, given that air pollution in London is a fairly unique kind of UK situation, but then it might not be. So any reflections?
Yeah, Paul, listening to the CMO's presentation and that graph, the chart he showed of air pollution in the United Kingdom, and you see the geographic heterogeneity. And he specifically mentioned that for outdoor air pollution, especially in urban centers and major conurbations in the country, that will be a particular concern for those areas. So for those areas, I would say, understand your data, understand your level of ambition, bring political and local leaders along with you on what you would like to achieve over what time period in terms of cleaning your air and tackling air pollution, and ensuring that the narrative on why this work is important and the benefits for reducing mortality, morbidity, economic productivity in place to create that case. So recognizing the heterogeneity and also thinking about, well, what is important for where you are in the country. But I think the CMO's report also highlights the importance of indoor air quality, Paul, and there may be parts of the country where actually that is the main driver that we need to be thinking about and considering.
Yeah,
but
indeed.
Also in other areas, the contribution of industry, other contributors for air quality in general might be important for other areas to tackle. So I think it's a place-based approach to look at the data, make the case, and identify your priorities for action.
Fantastic, thank you. I'm going to just test technology. Kate Dunn-Campbell wants to ask a question, so I'm going to see if my button will allow you to speak. Kate, are you there? I can't hear you. I have unmuted you, but maybe the technology isn't going to work for us. So if you could put your questions in the chat. Sorry, I'm not sure why we can't do that. There's one question which I thought, Kevin, we could try and answer jointly here, because we were asked, there's a question there about whether we played into the Planetary Health Hub event, which was in London a week ago. It's a very good question. And if I can start by just saying that we think very carefully about where we play our advocacy role. And whilst this didn't come under the radar that much because none of the Royal Colleges were invited, and but we do work with the UK Health Alliance on Climate Change, which is chaired by Richard Smith. Some of you may know it was the editor of the BMJ, who very ably chairs a very excellent multi-health agency group, predominantly the NHS, but we're in there very much welcomed participant there. And just to give you a flavour, between the special interest group that is very much the kind of energy hub of our climate change and sustainability agenda, under the Sustainable Development Specialist Interest Group, and ourselves, we have just in the last about 3 weeks, we've responded to 3 consultations. One was the Welsh Government on just transition to net zero. We responded to the DEFRA air quality strategy, and we also wrote a letter to Steve Barclay urging him to take part and support the climate and ecology bill, which is part of the 0 Hour campaign. So we do across the SDSIG and across the committee, we do actively involved in a lot of advocacy, but we are very mindful that we work on where we get the best bang for our bucks, and also that we are a credible advocate in this area as well. So Kevin, I don't know if any reflections from yourself on that as well.
I think, Paul, that's just a really good example of the type of advocacy that we've been able to do. And I think just want to reinforce that we have different advocacy avenues available to us. For many things, we do our advocacy work on air pollution and climate change with other organizations and partners as part of alliances. Occasionally, we may write or do work together with ADPH, the Royal Society of Public Health, or key public health partners. And then there are a few things where we will uniquely be speaking as the Faculty of Public Health. And I think understanding those channels for advocacy will be key. And it'd be really good to hear from members about, whether you're seeing that advocacy, whether it is resonating with you, and what are some of the other channels that we might take advantage of. And then the second reflection, Paul, that since starting as president of the faculty, I've been asking the subcommittee and the SIG about what is the public-facing messaging. Is there a space for us as a faculty to move into sort of public education, providing resources on some of the important issues related to adaptation, mitigation, and climate justice? And to what extent do we begin thinking not only of skilling up or workforce, but also being there as a credible voice for members of the public. And that's come to the fore for me as we've come out of the acute phase of the COVID-19 pandemic, where trust in government, trust in institutions is perhaps at an all-time low, and ensuring that we have a credible voice on these public messaging around a big and existential crisis like climate change is important. So I know that we're in the space of understanding what's possible, but I think that's combined with our advocacy channels will be two important avenues for us to consider as a faculty.
Yeah, thanks, Kevin. And just to, I mean, you've prompted a couple of other things as well, because the SIG is involved in advocacy work, which, I mean, this plays into what you just said, plays into that very well. And also just to recognise the excellent work of faculty officers, and particularly our comms team, which is not big, but we've been working on a new comms plan with the team there. And so this is coming hot on the heels of what you've just said, Kevin, as well. So that's very helpful. I think we are bang on time. With your permission, I'm not going to have a break. I'm going to, the subject matter is far too important. And Kevin, thank you very much for your presentation. I'm going to move swiftly on now to the next key part of this seminar, which is a round table. We have some excellent speakers, but the genesis of this came from a conversation that Kat, myself, and Stephen Holgate, so Stephen and ourselves started talking about such an event such as this about six months ago, and I'm really pleased that this has bloomed into a fantastic panel. And I'm going to ask Kat if she could introduce herself and the panel and run the event for the panel for the next hour, please. So Kat, over to you.
Thank you, Paul. So good afternoon, everyone. My name is Kat. I'm a clinical lecturer in public health and the public health registrar at UCL in London. And I'll be sharing the second part of the workshop or the webinar. We'll start with each of the presenters in the roundtable giving a brief presentation, about 5 minutes each, and then we'll have opportunity for Q&A, and I hope all participants engage in the discussion. I'll just kindly ask people to add the questions to the Q&A chat rather than the main chat, otherwise we'll miss the questions. During the discussion of the roundtable, you can also raise your hand and ask questions directly if you so wish. So without further delay, I will just start introducing Professor Sir Stephen Holgate, who is a professor of immunopharmacology at the University of Southampton and a key leader in the advocacy for good air quality. So, Steve.
Thank you, Kat, and thank you very much, Kevin, and everybody else in the faculty for inviting me to participate in this excellent panel today. I've got a few slides. The first two are summary slides, really, which pick up on what the two last speakers spoke on. Could I have the next slide, please? Thank you. So this really is a summary slide illustrating that the air we breathe is contaminated with both chemical substances that we generate outdoors, as well as chemical substances that we generate indoors. And these mix together. And of course, one of the great issues at the moment is we really do not fully understand the exposure pathways of all these different pollutants. And increasingly, as our Chief Medical Officer mentioned, we're realizing that the indoor environment is probably becoming an increasingly important place where we're actually coming into contact with chemicals that are damaging human health. A couple of other points on this slide I wanted to make. Most of the discussion around the long-term effects of air pollution come around the particulates, particularly the very small ones, PM2.5. And I just wanted to emphasize that this is not particulates just coming from the burning of fossil fuels, but also from friction and the shedding of materials from brakes and tires and roads. that we drive on. And secondly, NO2 is often talked about as an index marker of traffic pollution. And the important thing about NO2 is that it does have effects directly on the human, but it's a marker pollutant for other chemicals that are emitted, particularly from diesel vehicles of the older type. And finally, smoke from burning solid fuels is on the increase again now. And most of this, of course, is around wood burning. And we may have some discussion a bit about that as we get into the panel. Next slide, please, Kat. Thank you very much. The health effects you've heard about. I'm not going to go through this slide at all in any detail, only to mention that the Royal College of Physicians, hopefully with the other medical royal colleges, will be updating its 2016 report on the health effects of air pollution. And remember, this report was Every Breath We Take. It was published in 2016. It brought together health evidence, and there's been so much more new health evidence that's come forward since 2016 that an update, I think, will be very, very useful. So watch out for that. Next one, please. So the main topic of this panel is to look at the intersection of air pollution and climate change mitigation issues. And the point I really wanted to start with is by saying that air pollution, particular types of air pollution, have big effects on climate change, as well as adverse effects on human health. I'm listing here the short-lived climate pollutants: black carbon, methane, tropospheric ozone, and of course the hydrofluorocarbons. And these together account for up to 45% of global warming. Next point, please. Thank you. And of course, if we could only get these down quickly, we could have a massive effect on climate change over a relatively short period of time, whereas for diminishing CO2 is going to take much longer. Next one, please. Thank you. And this gives you some idea of, if we were able to impact on these short-lived climate pollutants, what beneficial effects it would have, in this case, on sea level rise. Next one, please. And here we have, shown on the right-hand side here, a diagram illustrating that if we not only attacked the CO2 side of the equation, which obviously is what net zero is all about, trying to achieve, but also attack the short-lived climate change pollutants, we could have a much more effective and rapid effect on preventing the warming of the air that we are associating now currently with the majority of CO2 that's emitted. So the SLCPs are an important target for us to go for if we want to go for climate mitigation as well. Next one, please. And of course, the reason for this is shown on this slide, is that A, these pollutants cause human disease, and you've heard about that already. Next one, please. Secondly, that carbon in particular, black carbon, has an incredibly powerful effect on increasing the warming around the world. And of course, here you can see the relative ratio of CO2 to black carbon, showing that it's 1,500 times more active than CO2 in this regard. Next slide, please. And of course, we're talking here about natural disasters, as Chris Whitty mentioned, with flooding, etc. Next one, please. And indirect effects like the deposition of carbon on ice flows, as you can see in the center of this slide, that increases the way sunlight warms and melts the ice. Next slide, please. So my final slide really is to show that if we do each of these things separately, go for the air pollution cleanup, go for the climate crisis mitigation, we get independent processes that obviously could, as Chris Whitty said, interact in a negative way with each other. But some of them, if we get them right, can interact positively. And I've put there a diagram that my colleagues helped create in the Clean Air program of how health-related activities can actually benefit both. And by actually going for the green agenda, which is shown in the middle part of the bottom of this slide, and also imposing the health side of the agenda on the top, we get the co-benefits, which are often synergistic. And that's what we've really got to try and achieve now, is the synergy between these two. And the last slide, please, Kat. Thanks very much. And this just shows really that we have on the environment build some targets to try and achieve over the next few years, as you can see. But the important thing here, next slide, please, and the next one. If we do achieve these, we'll make incredible inroads into being able to improve many of the chronic diseases we're trying to prevent at the present time, as well as being able to accelerate net zero gain. So these two things are synergizing positively in this case, and we hope that even before 2040, we can get to that point. Thank you very much indeed, Kat. Thank you. That's it. You can stop the slides now. There was a spare slide there, so don't worry. That's it. That's it. Thank you.
Kat, you're on mute.
Sorry, I clicked. Sorry.
Yeah.
Our next speaker is Professor Catherine Nowaks, Professor of Environmental Engineering for Buildings from the University of Leeds.
Hi, I think you have some slides of mine to share. Yeah.
Yes, we do.
No. Okay. Can you click the next slide? Yes. So I'm going to talk about indoor air quality and the relationships with climate. I know some of this has already been touched on both by Stephen and by Chris in his introduction presentation. I think indoor air is increasingly an important part of exposure. We spend a large amount of time indoors, potentially up to 90% of our time, either at home, at work, in transport environments, in social environments, and therefore indoors. And so an awful lot of the air that we breathe during the day, whether it's exposure to indoor pollutants or outdoor pollutants, actually happens when we're inside indoor environments. And then, as Chris, I think, already highlighted, if we've got those improvements in outdoor air, then the relative importance of indoor air becomes more. But actually, in some spaces, the indoor air can already be more polluted because of the sources and exposures that happen there. And there is also a very diverse range of pollutants in indoor environments, some that we're still learning about and some we don't understand well. Some of those pollutants are from activities that we do, from materials in the environment. Others are from human sources ourselves, things like infectious disease, which is not normally considered an air pollutant, but is influenced by the air in that environment. So I'll go to the next slide, please. So in terms of thinking about the impacts of climate, I think if we start thinking about where there's a direct impact as the climate changes, how is that going to change our indoor environments? Well, there may be some positives and some negatives in here. So from a temperature perspective, if we have milder winters, potentially that enables homes to be and other buildings to be naturally ventilated more readily without those consequences of cold temperatures. But at the same time, if we've got higher temperatures in the summer, we're more likely to get summer overheating in buildings, and they've become much more uncomfortable. And with that, those higher summer temperatures become higher outdoor air pollutants, for example, ozone, and the risk of things like wildfires, which then come into buildings or create environments where people try and shut the windows of those buildings and therefore reduce ventilation, so are more exposed to indoor air pollutants. And I think it's worth thinking about there where we have those extreme conditions, very extreme heat, buildings become the safe havens. And we already see in countries around the world that, for example, public spaces with air conditioning become the safe haven place. They become the place where people can shelter from those extreme temperatures and from the pollution. As we get wetter winters, we'll have higher humidity. Higher humidity leads to challenges with mold and damp in buildings, and are more likely to do that as those longer damp of humid periods carry on. And then in terms of extreme weather, other extreme weather, things like higher levels of wind, higher levels of rain, damage buildings, cause people to stay indoors, cause people to shut the windows, and change those exposures to indoor air pollutants. We think about the indirect impacts. There are a whole raft of things in here. So I think one of the biggest challenges we see at the moment is that retrofitted buildings and design of new buildings is often very dominated by energy and at the same time climate mitigation. So trying to be as energy efficient as possible, which of course is a very good thing. But then aspects around things like ventilation, which Chris touched on already, can often be missed when that energy is prioritized. And even when these things are done well, then it can be missed, and therefore we can create additional problems. And of course, people at home taking their own action to make their buildings more energy efficient often don't think at all about air quality and ventilation, and therefore create worse environments because of it. We see also that people are planning reductions. We see that organizational climate plans, reducing ventilation is a quick win. But if that actually leads to poorer indoor environments and health effects, it may not be the right solution. And the cost of such things like energy retrofit means that we've only got one chance to get that right, because you're not going to redo that. Again, once you've done it and created a poor environment, that's probably it. I think there are some opportunities as well as challenges around decarbonisation. So the move away from gas, oil and solid fuels into the use of solar, heat pumps, etc. That is a really good move for indoor air quality. It takes sources out of those indoor environments. But then there are some other factors in there that play into it. So high electricity prices, high energy prices change behaviours and drive people towards domestic burning. And maybe burning, we see that at the moment, people are not just burning nice clean kiln dried wood, which is not clean in the slightest. They are also burning all sorts of junk, and therefore that creates really poor pollutants in those environments. So, you know, it may be this big ambition to decarbonise, but at the same time people's behaviour comes into this. And there's also some interesting challenges, I think, with particularly transport environments. Electrification of transport environments reduces the energy that's actually available to provide a good indoor environment in those settings. So if you've got less energy available for your bus, it'll prioritise moving that bus as opposed to creating a good indoor environment on that bus for people. And so we do need to think about the engineering solutions there to make sure there is enough energy available to create good environments. And the last one I've put on there is around changing population and disease patterns. And this, I think, is a real challenge and an uncertain challenge, because we do know that, well, we know from the pandemic, infection risks are associated with the indoor air. We need to learn those lessons of the pandemic. We need to make sure that our infrastructure and our public health systems are resilient. But as well, there's things like opportunistic pathogens, Legionella in water systems. It's not strictly an air quality issue, but at the same time, with things we do to our buildings to make them more energy efficient, they're more like, and higher temperatures, we're more likely to see challenges with Legionella. But we may have things like increased risk of vector-borne diseases, which then actually changes how people might ventilate their buildings at night and openings in those buildings. So it has these knock-on impacts in there. And then, of course, as if areas of the world are significantly challenged by the effects of climate, that leads to migration, and that leads to greater pressure on buildings, infrastructure and services in an increasingly smaller part of the world, which potentially brings other problems in terms of indoor environments. So the next slide, please. This is my bad PowerPoint drawing of diagrams. It's complex, this. So the climate and the weather that results because of that climate is only one factor that creates our indoor environments. There are a whole raft of other factors that determine what those indoor environments are like, ranging from the guidance standards and behaviours all the way through to the physical conditions. And then that indoor environment has a vast number of impacts on our physical, mental health, on our comfort and productivity, and on the energy and carbon. And it's very tempting to focus on the energy and carbon, but actually we've got to focus on the health and the comfort and the productivity aspects as well. And this potentially where there are some tensions in there. And of course, just click on it again. There's some really bad arrows at this point. And again, Yeah, so there's a big feedback in here as well, in that as the climate changes, the climate doesn't just change the indoor environment, it changes our behaviours, it changes the standards, and the whole thing feeds back on itself. So we've got to look for where the win-wins are. I think there are some. So if we can tackle indoor sources, that's a good starting place, because many things around materials, products, etc., if those indoor sources are lower, then it's not such a challenge that we need to then solve with the buildings and with the engineering aspects of it. Good maintenance of buildings actually negates loads of problems. So simple things like making sure windows are open, making sure extract fans work, making sure ventilation systems are maintained, leaks are fixed, damps remedied, etc. Particularly in social housing, rented housing, this allows us to make sure that we start from a good place. If we can do design better, passive design of buildings, right thermal control, insulation, use of radiant cooling, can all mitigate some of those summer overheating things without having to push vast amounts of air conditioning in and the energy that's associated with it. We can have things like demand controlled ventilation, so we can ramp up and down the ventilation for occupancy rather than just blasting lots of air through all the time. And there are ways of putting heat recovery in. Lots of systems now allow you to put heat recovery in. You've got some energy for fans still, yes, that's true, but that's still a lot lower usually than the heating energy saving. So it's a net positive benefit. And of course, you're onto decarbonisation there to run it. A lot of talk about air cleaners, and these, which has been provoked by the pandemic, these can be a really good solution in some places because they can deal with the pollutants, deal with the poor air quality without the energy losses from opening the window. But whatever we do, there's a really strong behavioural aspect to it, not just the technical solutions. And I just want to finish by saying as well that we are working with Royal Academy of Engineering, IMechE, CIBSE and others to actually explore a lot of these areas from an engineering technical perspective, and where those complexities lie in the solutions and the trade-offs lie. Thank you very much.
Thank you very much, Catherine. And we'll move to our next speaker, who is Professor David Fowler, Professor of Environmental Physics from the Centre of Ecology and Hydrology in Scotland.
Hello, thanks for the intro. Could we move to the next slide, please? Chris Whitty showed this figure. The Royal Society produced a report in 2021 on the effects of net zero policies and climate change on air quality. I commend this to you, just have a look, it's easily obtained online. I'll deal with the climate change and air quality interactions, and Ali Lewis, who follows me, will talk about the effects of net zero policies on air quality. Next slide, please. Now, the overall impression on this slide, you don't need to read the words. This is just to give you the impression. I'll go through the main summary points in a moment. The key climate change impacts on air quality generally make things worse. They increase the concentrations in the air, either by increasing the emissions or by increasing the chemical processing in the atmosphere, for example, with ozone. So the only climate-driven process which results in improved air quality is high rainfall. High rainfall scavenges the pollutants from the air, obviously improving air quality. If we move to the next slide, what I've done in the next slide is to summarize the main air quality effects. In summertime, what we expect are more frequent and more intense heat waves, and these are likely to lead to episodes of high ozone and particulate matter. So that's degrading the climate in the summer. We expect improvements in the wintertime as air quality has less cold, stagnant conditions, which lead to the pollutant accumulation. Thinking back to the mid-20th century, those sulfur-driven smogs that Britain had everywhere, they're gone. Fogs are less common. So we expect an improvement in winter air quality and a degrading climate in the summer. We'd also expect to see variations regionally across the country. There is already a more continental climate in southeastern UK, and that's expected to become more prominent. The southeast is exposed to stagnant Met conditions and high temperatures and continental inflow. You'll be familiar with those episodes of high PM when we have the sunny spring weather, which also brings in air from very often continental Europe and from further east as well. So we'd expect the changes to be greatest in the southeast of the UK. The other change with time is that we'd expect that contrast between urban and rural air quality to narrow. The cities are going to clean up, and those episodes that are regional in scale will become the more dominant feature, so that air quality difference between rural and urban air will get smaller. Moving on now to the link with that, European sources are likely to become more important for UK's air quality, especially for PM and ozone in episode conditions. So if we want to improve air quality climate in the UK, we'll have to continue collaborating internationally. And most of the large-scale improvements we've seen over the last 3 or 4 decades, they've been driven by international agreements to reduce the major sources. We have very important local air quality issues, which have been discussed in the first presentation by Kevin. And obviously, action at a city scale is important, but the big improvements in air quality we've seen are those addressing the major sources. And move now to the emissions of ammonia, methane, biogenic VOCs, and soil NOx. These are all expected to increase with rising temperature. Ammonia emissions are particularly sensitive to temperature, but so also methane, VOCs, and NOx. We tend to think of NOx as solely something coming from combustion, and soil emissions have been largely ignored. But as we control all the combustion sources, gradually soil emissions are becoming more important. So reducing emissions of all of these, ammonia, for example, would substantially reduce PM concentrations and have added benefit for biodiversity by reducing the deposition of reactive nitrogen on sensitive ecosystems. Lastly, ozone will remain an important global and regional pollutant throughout the period 2050, up to 2050 and beyond. Climate-driven increases of the input of ozone from the stratosphere are obviously going to counteract some of the improvements in ozone generation in the troposphere. And we expect methane emissions from wetlands to increase. And it's important to emphasize that those background ozone increases over the last half century or so, they've been driven primarily by methane. And I noticed in the presentation by Stephen Holgate, he emphasized the short-lived climate forces. Controlling methane would give us huge benefits, and those benefits would accrue quite quickly because methane has a relatively short atmospheric lifetime. So methane will be something to focus on if we want to get relatively quick benefits here. So that's my summary of the air quality climate interactions. I'll sign off now and leave Ali to continue the other part of this air quality climate change report from the Royal Society.
Thank you, David. So I'm just going to say a few things about how net zero actions are potentially going to affect air quality. And as Chris mentioned at the start, there's been a huge reduction in emissions over the last 40 to 50 years at the national level. And we would expect to see this continue with net zero as well. So now the question is a bit more nuanced, which is around reducing emissions where people actually live. So in some ways, looking at overall national emissions and the reductions that are driven by those can be a little bit misleading, because you can get some very big drops by closing some coal-fired power stations, but that can have quite modest effects on people within the UK. So question now is on the decisions we've got around net zero and how these might play out, and how we might optimize them for delivering maximum air quality benefits. Okay, so next slide, please. And the next one. Next. So from the report that David described, one of the chapters looks at some of the effects that might happen from net zero policies. And although I guess we're all familiar with electrification of passenger cars as a very obvious sign of kind of net zero in action, and also, you know, the growth in renewable energy, we really still are only in the foothills in terms of decarbonising the UK overall. There's an awful lot of emissions still to be got rid of in terms of greenhouse gases, which means there are an awful lot of sectors that will impact on air quality as well. So the Royal Society report has a sort of qualitative assessment of the likely scale of benefit or disbenefit of some of these actions, and it's shown with bars, really giving a feel for the size of the uncertainty. And there are some, you know, real clear win-wins associated with net zero and air quality. So if you change your power system from a gas-fired power station to renewable energy, it's clearly a benefit to both. Electric vehicles, as has been mentioned a couple of times, will clearly be very beneficial and will slowly eliminate nitrogen dioxide, although they will retain some particulate emissions. But we are faced with quite a lot of other decision points in the next few years around decarbonisation. And perhaps not all of them are quite as clear-cut in terms of whether they're win-win or not. So overall, I think we can say with some certainty that net zero is mostly beneficial or neutral for air quality. And in lots of places where there are potential antagonisms between actions, there are mitigations available should we choose to introduce them. But we do have some areas really where still the science doesn't tell us very much about even which direction the impacts might go in. And I've highlighted one here, which is that, you know, under net zero, we may see significant increase in forest cover in the UK, which will lead to a change in biogenic emissions of not just VOCs, but pollens and so on. And that will have an effect that's really very uncertain. But the width of a lot of the bars here is actually associated with the technology we did decide to implement. And you can see for some, particularly associated with transport, for example, the use of hydrogen or biofueled engines, how we implement the decarbonisation of buildings and agriculture and so on. There's a lot of uncertainty around what the air quality impacts might be. And a lot of that will be down to the choices we make around exactly how technically net zero is implemented. So next slide, this is my last one. Just some key considerations we have to keep in the back of our mind. And, you know, electrification of vehicles, whether that's cars, buses, lorries, and so on, it will slowly solve the issue to do with roadside NO2 in cities, but we will retain the non-exhaust emissions from particulate matter, and non-exhaust emissions of particulates already exceed what comes out of the tailpipe even now. And there are some projections for the future with electrified transport fleets that actually show higher overall mileage and heavier vehicles. So we have to keep an eye on this one, because there is some potential, if we only go down the route of electrifying and driving everywhere, we will potentially see our PM emissions also increase from the non-exhaust component. It's obvious, but it's really worth stating that not all of net zero will be delivered by electrification. The bits that we see in terms of passenger cars are electrification, but a large chunk of the UK's net zero strategy is associated with burning things or burning lower carbon fuels. So, for example, we still have in play a policy decision around burning hydrogen as a way of heating our homes. Well, that leads to NOx emissions. Ammonia is being proposed as potentially the main replacement low carbon fuel for the maritime industry, which has a big impact on some coastal parts of the UK. Again, that generates NOx and particulate matter. Biofuels are likely to play a role. Sustainable aviation fuel is likely to be the main fuel for around airports and so on. So all of these low carbon fuels lock in and retain negative air quality impacts. And so we'll have to make some choices on what emissions we're going to see. And just finally, different parts of the UK are likely to see different levels of benefit arising from net zero, depending on local sources. So those cities whose pollution is particularly dominated by road transport, for example, with NO2, may see some pretty big gains from the electrification of the vehicle fleet. Those parts of the UK that still have significant industry activity as a source of pollution may see lower gains. So the impacts of net zero on air quality in the UK may not be evenly distributed. So I guess my take home from this is that we still have a lot of choices ahead of us, and we need to really carefully evaluate all of those to ensure we've thought about the air quality consequences, and particularly for actions that may lead to air pollution where people live. So I'm very, very convinced that the total amount of emissions of PM, NOx and many other pollutants will be much lower in 2040 and 2050 than it is today. But really the key test is whether we've actually lowered the emissions in cities and near the streets where people live. So I'll stop there.
Thank you very much. And let's move to our next speaker, Helen Apsiman, who is a professor of air pollution studies from the Faculty of Natural Sciences at Imperial College London.
Well, thank you very much. And Ali's already said a lot of what I think I was thinking about. But since Brexit, my work has largely been for DEFRA in assessing future air pollution scenarios for the UK to 2050. So looking at that longer term ahead, and in particular setting targets for PM 2.5, which we saw introduced by Stephen Holgate there in the Environment Act for 2040. So one of these is setting an annual maximum concentration for NO2. That's a traditional way of controlling pollutants, and that's the one that everybody seems to have concentrated on. Now, what I want to point out is that 10 micrograms per cubic meter, which is the old WHO standard, now tightened to 5 micrograms per cubic meter, is not a safe level. It doesn't mean that if you get down below that level, you are safe for the health effects. There is no threshold established for no health effects of PM 2.5. And this is why we put a lot of emphasis in setting a target for reducing the overall population exposure by 35%. And I think that is going to be much more demanding, actually, than achieving the maximum concentration limit. Now, in doing these scenarios, we were superposing pollution abatement measures on different energy scenarios for reaching net zero. And the illustration I've given here is an example for one of these scenarios, showing that the net zero measures can account for a large part of the improvement in air quality. So the height of the column represents the improvement made in reducing the population exposure to PM 2.5. And the orange bit is the air quality measures. The blue bit is the improvement you're getting from the net zero scenario. Now, that's an illustrative scenario. It varies an awful lot with the energy scenarios. So if your net zero scenario is going for things like carbon capture and storage, and you're still using your fossil fuels, it doesn't make as much difference as if you're going for renewable energy, wind power, etc. And of course, as Ali has just indicated, we have new fuels coming along like hydrogen and ammonia, and we need to think very carefully about those energy scenarios and strategies. We have to make decisions within the next year or so on whether we're going to use hydrogen to heat homes. And there's a lot of controversy going along on that, and on building new hubs, which are burning hydrogen completely to power the home's heating. So there's a lot to do there in looking at these different scenarios and making sure that we don't make the same mistakes that we made, for example, with diesel cars, as was mentioned earlier. So next slide, there's one other point I want to make, and this is that I don't think we think enough in the policy on the temporal aspects. We've had this dissociation with climate targets really focusing on net zero by 2050. We've had air quality targets, emission ceilings by 2030, some interim targets like UK electricity production being carbon neutral by 2035. But what I want to point out is the timing of the measures when we bring them in and the cumulative effect is also important. And here I'll use the example of electrification of road transport, which has already been alluded to, where you can see in the top part of the diagram, as you electrify, you bring down the emissions of NOx, but in the bottom part of the diagram, you don't necessarily bring down the emissions of primary PM, and all the questions that have been raised. We're looking at different scenarios for DFT now on how electrification and road use, etc., might vary. But I think the thing to recognise is we've got policy that we're going for no new internal combustion engines from 2030 or hybrids from 2035. Now, that's not just chance. It gives us the reduction of NOx and PM 2.5, but it needs to be synchronized with the energy projections, because if it had been brought forward, we would have been producing that electricity from fossil fuels. If we delayed, for example, by 5 years, that would have added about half a gigaton to cumulative CO2 emissions by 2050. So the timing and synchronization of the way we take the climate measures and the way we take the air pollution measures is important, and we need to pay attention to it. And it's the cumulative effect that is important. So I think I'll stop there, because I think other points have been made by other people.
And finally, we have Dr. Gary Fuller, Senior Lecturer in Air Quality Measurement at the Faculty of Medicine in Imperial College London. And I think Gary will share his own slides. Thank you, Gary.
Hi everyone, thank you for that. I was just going to share my own slides, which I hope people can see. I'm having a bit of laptop troubles at the moment. But really the point I wanted to make is, if we're going to bring people with us and convince people to take the measures that are necessary, then I think we have to reframe this a little bit, and also think about presenting air pollution as an opportunity to do things in ways that people might be able to associate with. I did this piece for The Guardian a little while ago, where I thought about what a smog-free city could look like. And I'll let you have the chance to, or you can have the chance to go and look at that separately. It's about moving beyond this debate of just, how should we be powering our vehicles, into how we get the right sort of transport, what we do with our urban spaces. Can we turn roads into parks, for instance, how we heat our homes, and also accepting that a lot of air pollution that we experience comes from somewhere else. So our neighbours need to help. I'm sorry this one hasn't come out quite on the screen, on my screen anyway, quite as you would expect. There's huge opportunities in helping people move away from motorised travel to active travel and public transport. There's data, of course, from DFT that says that 23% of the urban journeys we make by car are less than 2 miles, and 60% are less than 5 miles. And when I present this a lot, people say to me, oh, this is just a London figure, etc., etc. No, this is the average for England and Wales as a whole. And many of these shorter journeys can be easily turned into other means. What would happen if we can do so? Well, there's a really nice study done on Biobank, and I'm sure many of you will be aware of Biobank. There's I think about 400,000 people in this, of which around 260,000 are workers. And already in a 5-year period, I'm sorry, I'm having many slide problems here. In a 5-year period, they were managing to find cycle commuters within Biobank, and this 260,000 were living longer, and the walking commuters had less heart disease compared to those who were car commuting. So that gives us a huge opportunity to be able to do something really positive for public health from a net zero direction and from air pollution policies. There's been some appraisals of schemes like these that do cycle hire in our cities. And when the first ones put in Barcelona, there was a concern, sorry, I've got an auto advance here. There was a concern here that we will be doing more harm than good. So in terms of the harms, there is greater air pollution exposure to the cyclists and also a greater risk of accidents. But when this is weighed against the benefits from the additional exercise that people have, the return was a benefit to sort of disbenefit ratio of around 70-1. These studies have been done quite a few times since, and that's come down to about 50-1, but it just shows the huge opportunities that are there. Another one, which I think will play to many of you here in public health, is just in the burden of long-term chronic diseases. Another biobank study here that was published around Christmas time looked at the associations between people with multiple chronic diseases and the air pollution that they're exposed to. And you can read more. I did a piece for The Guardian about this, and the paper itself is here in the slides. And these two panels here shows the association between the sort of quartiles of the propensity for chronic diseases and PM2.5, and here we have NO2. And we also have rate ratios for different types of chronic long-term disease. The study authors said that the difference between living in an area that's worse for PM2.5 than England's 2040 target and living in an area that's better is around a 20% chance of chronic long-term illness. So, I mean, it's just one study, and it's not sufficiently there to really give us about causation, but it really opens up opportunities. Stephen kind of showed a little version of this diagram here. Here we owe huge debt to our late colleague Martin Williams, who did something that showed, if you like, just thinking about the ways of trade-offs between climate change and air pollution policies. So here we have horizontally a climate change axis, and vertically we have an air pollution one. The things in this top right-hand corner are all things that can be good for both. Good for air pollution, good for climate. Unfortunately, a lot of the things that we have done in terms of climate have been very adverse for air pollution. We're talking biomass burning, urban CHP and dieselisation. Some of these are issues that come up earlier. But since we're in public health, let's go one step further. And I'm really rubbish at graphics, so I do apologise for this. But just imagine with me a third axis here that could be coming out of the page with health benefit. And we can just think about optimising our policies for health benefit as well as climate change benefit as well as air pollution benefit. So for instance, there's the electric vehicles versus active travel. There's a huge health difference between them. Other ones might be heat pumps in homes or insulating homes and also addressing fuel poverty, for instance, or creating livable cities and things like that. So the examples are many, and I won't go into them. But I just think this is very much a paradigm that we should be thinking about and a lens that we should be viewing this through. My colleague Alice, as Stephen flagged this up through the Clean Air Champions, did this Venn diagram where we kind of have this sweet spot in the middle of the things that are good for all of these agendas, which are the optimal policies that we should be aiming at. Also, is there an opportunity to address some of the health inequalities through our actions on climate and our actions on air pollution? Again, here there may be many opportunities, but if we think about it, inequalities come not only through deprivation, but also through people who are at vulnerable periods of their life for air pollution exposure. And one of these obviously is children. So one solution there, whether we should be putting this much more mainstream into our policies, is that of school streets, actually, you know, opening up the streets around schools, not just for traffic, but actually to be areas for walking and cycling. And if you've ever stood in one of these school streets, they're fantastic. Before the school street's in operation, all the children are at the gates behind those little fences that stop them running out into the pavement. Close off the road to traffic, open it up to other things, and you turn roads around schools, not from being a problem and a hazard for the school into being an asset, as well as there is indications that it's improving air pollution, reducing climate emissions, therefore, and also encouraging active travel. So I think there's many ways in which this agenda can be drawn together. And then if we really want to be radical, let's think about how we use our street space in our urban areas. So the top 4 panel, those on the top left here, show Seoul in South Korea, where they had this massive road, a bit like the Westway, which isn't too far from me here at Imperial, that took traffic into the city centre. And this was creating a lot of problems. And so rather than build new roads, what the mayor did, and got re-elected for doing so, was to rip out all of this, to bring to the surface an old river that used to lie beneath this, to create a green active travel corridor, as well as a place for people to go out lunchtime, enjoy time being outside, and greatly enhancing the city space. Same here in one of the Dutch towns, where there was this massive road that was actually built over a canal, and the process was reversed. So let's think a lot more creatively about how our cities could changed. There's also this other voice in the background, but I'll just say here briefly that there's other sources of air pollution that we need to think about, like agriculture, the solvents that we're using in our homes, as well as tire and brake wear. And lastly, I'll just end with a couple of slides that give hopefully a vision for what our cities could look like. All of these places exist in the UK, and they're all places where I would certainly want to live. So we need to be putting this positive vision forward of how we can get these agenda to work together. Thank you very much.
Thank you very much, Gary. And I'm going to start asking the questions that are on that were written and submitted to the panel. And if anyone wants to ask questions, please add your questions to the Q&A stream rather than to the webinar chat, because otherwise we'll miss them. It's also possible now for you to raise your hand and ask questions if you so wish. So someone mentioned that the draft air quality strategy doesn't refer to the WHO air quality guidelines from 2021, and the targets are actually less ambitious. And I think this goes back to what Helen said, that no level is safe, and all air pollution is harmful to a certain degree. But should we not be striving for meeting at least the WHO air quality standards?
Should I answer that?
Yes, of course.
I think what you need to realize is that quite a lot of the particulate pollution is not anthropogenic. There's a large contribution from natural dusts, sea salt, or all sorts of other water, other components. And over a large part of the UK, that natural component will be nearly up to 5 micrograms per cubic meter. So that would be a real challenge in trying to meet 5 micrograms per cubic meter. I don't think it just wouldn't be possible over parts of the UK. By trying to look at the population exposure and reduce that as much as possible, I think we are striving to reduce the health effects as much as we possibly can.
Thank you very much, Ellen. And then someone asked, are there any good examples of how to tackle risks associated with window open to facilitate ventilation? For instance, children falling out of open windows. And I think that goes to Catherine.
Yes, I mean, you don't have to have just a wide open window. You can have high level windows that open that children can't reach. You can have vents which have multiple layers of openings. So there are lots of small openings as opposed to one great big opening. There's lots and lots of design. I think one of the challenges, and again, this is something that I think other people have touched on, is that often when things are designed retrofitted, the cheapest possible option is taken. So the one window with the one opening is cheaper than the window with two openings. And of course, the more deprived areas there are, the more those cheap options tend to be taken and the more we embed poor solutions in. So I think, you know, good design from the beginning can really solve things.
Thank you very much, Catherine. Then the next question is that some people mention that our weather is influenced by the European continent, and we have seen, for instance, last summer or towards the end of last summer, that dust can cross the sea, and for instance, if there are wildfires in Iberia, black carbon can cross and reach us. Is this significant in terms of airborne pollution, or are the levels that reach us eventually too low to have significant health impacts? Steve, do you want to answer it?
Well, there's just one point I do want to make at this juncture, actually, Kat, and that relates to the toxicology of these particles. And we've been talking about particles and their sources, which is important, as part of this big agenda. But not all particles are the same. And I think what we probably need to be thinking about concentrating our efforts, as Helen said, on the emissions that are causing the most problems. And to do that, we've got to understand which are the most toxic. So we heard Helen's talking about sea salt and maybe dusts of various sorts coming. But then we hear particles coming from tires and roads and brakes. And there's going to be a big difference in the toxic effects of these on different biological markers. So I'm quite keen, really, that we actually, although we still talk about particulates as a whole, I think we should be creating a greater understanding about what is relatively more toxic compared to others. And an area that I think is particularly important here is the non-exhaust particulates that we heard about from tires and brakes and so on, but also the secondary particles, which we heard about, both indoors and outdoors. How do they compare with some of these other particulates? Because obviously, as they formed from different substances, their effects on different disease processes may differ. So I know that's not quite answering your question. Maybe David Fowler can answer this sort of question geographically rather more precisely.
I think your answer was actually more useful than what I'm likely to say here. We've always seen these episodes of Saharan dust in the UK. I mean, people have washed it off the top of their cars on odd occasions, most summers in the UK. So I think those very long range transport episodes are not dominating our particular climate in the UK. But you'll see from our report and the comments that I made earlier, we are expecting in a more continental climate to have greater influence of the inflow from continental Europe, especially in southeastern UK. And so it will gradually become more important, especially as we clean the air in our cities.
Mm-hmm.
I've got one thing to add on this. I think people think very much of emissions in other countries. What they tend to forget, and I see this being the odd question about shipping and other forms of transport, is that the UK is encircled by a ring of shipping. It's very, very high emissions. There's about 650 kilotons of NOx, which is more than UK emissions would be very soon in a big circle around the UK. So there are other sources that we have to think about as well as just other countries.
Yeah.
And in a conference I've just been to in Sweden, which was a sort of think tank about where we're going in future, very much the Nordic countries are really emphasising the methane and black carbon because of the concerns about the Arctic. So I think that's another thing we need to think about. It's certainly going to be dominating quite a lot of discussion within Europe on where we're going on the air quality side.
And I want to ask one question that I think is quite clever, and thank you, Karen, for asking this. What are the links between the food system as a whole and climate change and air quality? Are there any examples from evidence of links and opportunities for reducing health risks? Because we know that the agricultural sector contributes both for emissions and for pollution, not just methane, but even the particulates and everything that is released, and fertilizers, whatever.
Well, could I go first on that
Yes.
one? Because agriculture is the main source of ammonia. It's the pollutant we've done least about, and it's directly connected with our food supply. And the ammonia doesn't just come from all sectors of food. It's primarily the livestock farming, especially the high input livestock farming is the major source. So a focus on improving efficiency of nitrogen use in agriculture would be one major benefit. But anything that reduces ammonia emissions, it makes a substantial contribution to PM, especially in these springtime episodes. So
May I
leave others.
May I
Sure.
throw something in the discusussion, which is a very selfish perspective would be, well, instead of having national production that improves food security and reduces the carbon miles of or our carbon footprint, reduces the food miles of the food we eat, but then that means that the air pollution is going to be generated elsewhere, probably in a low-income country that has even less ability to implement strategies that reduce the carbon cost and the air pollution cost of producing food. So what is your view? How do we balance all those risks and the selfish or the global perspective on air pollution? Do we look at just as the harms for our population, which is better to produce our food elsewhere so that we don't get the air pollution from producing food? Or do we think about everyone and all the potential harms?
Well, there are big arguments that come onto land use here. If you look at the measures in the climate CCC report, we would run out of land if we kept on agriculture as it is at the moment. So there have to be changes. But we've got huge obesity problems. So we need to change diet for other reasons.
And we also need to change it's also about the way food is processed as well, isn't it? So by having highly processed food that's high in sugar and salt, that contributes to the obesity problems. That also contributes to inequalities. And it makes it more difficult for people to have a healthy diet when you haven't tackled that manufacturing issue. The use of water as well in some of these is really important. We haven't talked about water today, but obviously water pollution and the water usage is a massive issue for us. But I think as a country in the global north, if we're serious about any of this, we have to make sure that we tackle things so that we have a polluter pays and a consumer pays policy so that we don't just export our problems, because as we're seeing now, we're likely, even if you try to export the problems, they do come back and bite you quite heavily on the bum, don't they? So really thinking about how we think of ourselves as part of a globalized world and stop exporting our problems, I think is critical for us. And I suppose this brings me into one of the questions that I think is really key for our discussion, and it's been I put it in the chat, it's been a real feature for us, that there are some really interesting, really exciting technical solutions. The role of engineers in all of this is absolutely phenomenal, but at the moment where we're really lagging behind is getting that political and public confidence and will behind us. The public don't trust politicians, and politicians don't do things that they think will be unpopular with the public. So we're in a real catch-22, and one of my key interests, I think, and I'm a director of public health in a local authority, is about how we support local authorities in particular to make those braver choices, especially around planning, in the absence of much sensible national conversation about a lot of this. I do feel that we expect local politicians to pick up and run with things that are actually extremely difficult for them to do. And so how do we as public health professionals support and engage in conversations about those changes? And when you look at the work Gary's done about the urban areas, and you can see how much nicer, everybody will look at those pictures and see how much nicer the change is, but trying to get the public to believe you at the start of any of these journeys is just so difficult. And how, but it feels to me that that's the heart of our public health crisis at the moment, that's where we need to be working.
Anyone else wants to comment?
Well said, Eleanor. I just there's probably time for one more question, Kat, and then
Yes.
start summing up. Yeah.
Well, one interesting question is from David Patterson. How is the UK still working with the EU on these issues post-Brexit of interstate action on the food system and air pollution and climate change?
I think really, Steve Holgate here, I'll come into a starter because as you heard from Gary Fuller, we are meant to be clean air champions with a big program on air pollution that's being researched at the moment, which is very exciting. But I think one of the most important things for us to do really is to explore ways that we can utilize language to get people to think about changing behavior. And you usually have to incentivize people for this. And of course, we're not now just talking about the United Kingdom, because we go to countries like, the Netherlands, for example, Amsterdam is often quoted, or we go to some parts of Switzerland. These are areas quoted for what they've achieved in terms of various interventions they've made. But I mean, we need case studies, not just statistics, to be able to persuade people that by doing certain things can create an environment which is a much nicer one to live in for everybody. And of course, like everything in life, there are pluses and minuses. So I think as the Faculty of Public Health, one thing that we might do is to try and actually come up with a matrix, of how we can deliver positive messaging around this theme, which we can learn a lot from our overseas colleagues, and to start thinking about how we can join up the advocacy initiatives that Kevin and others talked about earlier on, through which the faculty is obviously very active.
Alistair, just very few seconds. And then
well, I just wanted to give a sort of technical answer to this, which is that the UK is a signatory to the Convention on Long-Range Transboundary Pollution, the Gothenburg Protocol, it's sometimes short. That isn't a European Union institution. The UK is still part of that. And I believe the UK is co-chairing with Sweden the setting of new targets. So I think we have to be reasonably positive on that one, that the UK is still engaged in international cooperation on transboundary emission pollution. And I think would probably argue that it's taking a lead.
Alice, just to add to that, what we're leading with Sweden is the Forum for International Collaboration. So it's trying to spread the work that we've done in Europe more globally.
Thank you very much.
That's what HiCap is about.
Yeah, thank you very much, Helen. I'm sorry, I realised that I'm probably cutting into a really fascinating conversation here, but I wanted to make sure we did finish at 4, which is our agreed time. And just to quickly summarise, I mean, I think we aimed with this event to bring together engineers, physiologists, immunologists, chemists, environmental scientists with public health practitioners. And picking up the gauntlet from Stephen just now, I think we do need to build a partnership. I hope this does start to set the scene for that. We've heard from, if you like, quite a lot of technical issues here. which is good to hear, particularly the tensions and the choices, whether it's ventilation, energy costs, or sources of new energy such as ammonia. It's really useful to hear. It's also useful to see, I like Gary's, if you like, sweet center in his Venn diagram, which really just said, if you really want to focus locally, regionally, nationally, then you must be focusing on heat pumps, electric vehicles, solar, and active travel and livable cities. I think that was a great message for all of us. We will be we have been recording this. We'll share that, and I hope with all the slides as well. The faculty is very engaged in the science of this, and I think you may have seen earlier conversations from Anya and Maria. We have a very active SIG. So whilst the committee is very much part of the faculty infrastructure to make sure we engage Kevin and everything else in consultations, we've got a very active specialist interest group which Anya and Maria chair. So please do feel, if you haven't already joined, do join that. We also have a combined newsletter, and with all the events and things coming up, we've got a couple, 21st of June on adaptation and 29th of September on climate justice, which will help us in our preparations for COP28. But finally, can I just say a big thank you to all our panelists just now, which was a brilliant conversation and discussion, and to Kevin and the CMO earlier. Special thanks to Kat, who put a lot of this together, working with Hannah Booth, our other specialist registrar. And we've also got, just to advertise, if anybody else who's listening, who's a registrar who wants to join the team, then do get in touch with us. Eleanor, who you heard from earlier, is our education supervisor, and we can cover training through that route. And thank you to all of you for joining and making this an excellent seminar. And I hope the start of some great things to come, a really important partnership. So my thanks to all of you, and have a good rest of afternoon. Thank you very much.